So child abuse definition: any action which endangers or impairs a child's psychological or emotional health and development. So any action that affects the child physical, psychological and emotional health and development is defined as a child abuse. So there is a variety of experiences that are threatening or harmful to the child and that are result of acts of commission or omission on the part of the responsible caretaker. So what are the types of child abuse? Physical abuse, emotional abuse, sexual abuse, MUNCHAUSEN syndrome by proxy, intentional drugging or poisoning, and shaken baby syndrome. These are the types of child abuse. Let's see about individual types. So first one is physical abuse. So physical abuse is defined as any act which results in non-accidental trauma or physical injury. So it can also be defined as any act resulting in non-accidental physical injury, including not only intentional assault but also the result of unreasonable punishment also. So gags applied to the mouth may result in the bruises and lichenification and non-scarring at the corners of the mouth. So these are the physical abuses. So injuries of the oral cavity, including posterior pharyngeal injuries and retropharyngeal abscesses, may be inflicted by caregivers. And the physical abuse is the most visible form of abuse, and it is 50% of the physical abuse resulting facial and head injury, which can be recognized by the dentist. So physical abuse include hitting, shaking, suffocating and other ways of inflicting pain or injury to the child. So generally the abuser or one or both the parents or caretaker. So we have to take proper history. The history does not coincide with the symptoms present. This is how we take the diagnosis of physical abuse. So next, moving on to battered child syndrome. It's very important. Battered child syndrome. It is a severe form of physical abuse and there is a collection of injuries sustained by child as a result of repeated mistreatment or beating. So it is first described by Kemp in 1962 and it was elaborated by Kemp and Helfer in 1972. So there is a bruises, laceration, burns, fractures are commonly inflicted injuries. So the investigator must be careful about the fact that the major trait of these caretakers is either complete lack of explanation for critical injuries or explanation that do not account for the severity of injuries. So once the caretaker learn that their explanation do not match medical evidence, they come up with the new ones. So we have to differentiate the caretaker's explanations. So it is battered child syndrome, so it is a severe form of physical abuse. So indicators of physical abuse are: first one is injury unusual for a specific age group. Example, fractures in an infant. It is very not specific. And specific bruising patterns. There is a cigarette burns, belt buckle mark and finger imprints. These are the specific bruising pattern. And the third one is injuries with poor explanation. And the fourth one is multiple injuries and different stages of healing. And next, moving on to the physical abuse in extraoral, there is a ecchymosis. Slaps, fits, bites produces ecchymosis. And bruises. Bruises is battle sign. And excoriation and abrasions, laceration, contusion, hematoma, burns, cigarettes, lighters and hot instruments, traumatic alopecia. Next, lichenification of commissures. These are the extraoral symptoms in physical abuse. And the intraoral signs are tone, labial and lingual frenum. There is abrasions and lacerations of the gingival, tongue, palate and floor of the mouth. And there is a fractures, dislocations and avulsions and pathological mobility of the teeth and fractures of the mandible and maxilla. And there is a malocclusion due to the previous trauma. These are the intraoral signs of the physical abuse. Next, moving on to indicators of physical abuse. Next, moving on to the emotional abuse. So in emotional abuse definition, systematic tearing down of another human being. So and it is least understandable and more prevalent and most cruel and most destructive type of abuse is emotional abuse. So it can seriously interfere with a child positive development as it attacks the child's psyche and self-concept. So these children have a low self-esteem and feel him or her to be unworthy of love and affection. And what are the types of emotional abuse? First one is rejecting. In rejecting, parents who lack the ability to bond often display rejecting behavior towards a child. They tell their child in a variety of ways that he or she is unwanted. So they may also tell the child to leave the house and call him or her names and tell the child that he or she is worthless. So leave the house and worthless, you are unwanted. These are the rejecting factors, rejecting sentence. And ignoring, parents who have had few of their emotional needs met are often unable to respond to the needs of their children. So unable to respond to the needs of the children and they not show attachment to the need of their children is ignoring. The third type of emotional abuse is terrorizing. So parents criticize and punish the child. They may ridicule him or her for displaying normal emotions and have expectations far beyond his or normal abilities. So they have the higher expectations about the child. So the child may be threatened to death, mutilation, and abandonment. So these are the threatened in terrorizing. And the next one is isolating. So a parent who abuses a child through isolating may not allow the child to engage in appropriate activities. And parent isolate the child, keep the baby in his room and may prevent teenagers from participating in extracurricular activities. These are the isolating type of emotional abuse. And the next type is corrupting. So parents permit children to use drugs or alcohol. So normally parent won't allow, but these parents allow to use children to use drugs and alcohol, and they to watch cruel behavior towards animals because they are very careless. So these are the corrupting types of emotional abuse. To watch pornographic materials or adult sex act, they are not respond. And the next one is indicators of emotional abuse. The first one is poor self-esteem and insecurity and destructive behavior, angry act. And the fourth one is withdrawal, poor development of the basic skills, and alcohol or drug abuse, difficulty in forming relationships. So emotional abuse, unlike physical abuse, it is difficult to diagnose due to lack of evidence. So in some instances, an emotionally abused child shows no signs of abuse. It can leave behind hidden scars, so that can later manifest as poor self-esteem, destructive behavior, antisocial act, and suicidal tendencies, and alcohol or drug abuse. So these are the indicators of emotional abuse. So in emotional abuse, lowering a child's self-esteem by harsh treatment, ignoring, shouting or speaking rudely, name calling, and use of abusive language, and comparison between the siblings and other children. These are the points in emotional abuse. We have to remember these points for easy identification. So the next type of abuse is sexual abuse. So there is an involvement of dependent, developmentally immature children in sexual activities that they do not fully comprehend, and therefore to which they are unable to give informed consent, and or which violates the taboos of society. So it is defined as any misuse of a child for sexual pleasure or gratification. It interferes with child normal healthy development both emotionally and physically. So these children experience severe emotional disturbances from their own feelings of guilt and shame. So there is an extreme end of the spectrum. Sexual abuse includes sexual intercourse and its deviations. And the next one is indicators of sexual abuse. So what are the indicators? So first one is compulsive masturbation, and second one is excessive curiosity about sex, and bruises or bleeding from external genitalia, and difficulty in sitting or walking, sexually transmitted diseases, any signs of forced oral sex as mentioned above, and pregnancy in early adolescence. These are the indicators of sexual abuse. So sexual abuse, the role of the pediatric dentist. It is described by Casamasimo. So the role of the pediatric dentist in child sexual abuse is not clear as for other forms of child abuse and neglect. So several factors complicate the willingness and ability of the dentist to identify the child sexual abuse or deal with suspicions. So what are the several factors that are complicating the identify child sexual abuse? Or first one is sexual abuse occurs without physical findings, and the dentist may be unwilling to address the sexual abuse issue because of its volatility and possible negative repercussions. And third one is positive cultures for infections, and this presence of sperm, and dentists may not be aware of the oral manifestations of venereal diseases or other oral sexual lesions, and the transient nature of the such lesions as oral gonorrhea and intraoral trauma decrease the likelihood of identification and verification of an episode. So these are the factors complicate the ability of the dentist to identify child sexual abuse. So other types of other types of abuses are easily identified by dentist, but this is very difficult. In sexual abuse, there is ulcers, vesicles, there is a purulent drainage or pseudomembranous and condylomatous lesions of lips, tongue, palate and nose pharynx. There is erythema and petechiae and of an unknown etiology on soft and hot palate junction or floor of the mouth. There is erythema or petechiae, but it is unknown etiology. Maybe it is due to the sexual abuse. Then so note, differentiate these from traumatic lesions, hemorrhagic lesions, violent cough or vomit, bleeding diathesis, antithrombotic or anticoagulant pharmacological therapy. So behavioral markers in victims of sexual abuse are improper sexually explicit conduct and heightened defensive behavior. Child may feel threatened by excessive physical contact or even just conversation. So the child may feel threatened. So these are the symptoms in sexual abuse. So next, moving on to Munchausen syndrome by proxy. It is very important. So it is a psychological disorder in which the patient fabricates the symptoms or injury in order to undergo medical test, hospitalization or even medical or surgical treatment. So patient himself, they create the symptoms or injury. So to command medical attention, patients with Munchausen syndrome may intentionally injure themselves or induce illness. So it is first described by Dr. Richard Usher in 1951. So he reported adults who fabricated symptoms about themselves and produced signs of illness. So the Munchausen syndrome by proxy, a parent or caretaker attempt to bring medical attention to themselves by injuring or inducing illness in their children. It is also another type of Munchausen syndrome by proxy. So Dr. Roy Medowa first coined the term Munchausen syndrome by proxy to describe the preservation of the deception with regard to the child. So what is the definition? So Munchausen syndrome is defined as the intentional production of physical or psychological signs and or symptoms for the purpose of assuming sick role. So intentional production of physical or psychological signs and symptoms in another person who is under the individual's care for the purpose of assuming the sick role by proxy. It is also the definition. So the most clinically useful definition is provided by the Bools et al. In 1992. What are the definitions are? Illness in a child is usually fabricated by a parent or someone in loco parents. And the child is usually presented for medical assessment and care and usually persistently, often resulting in multiple medical procedures. So here the incidence and prevalence are: the fatality rate for Munchausen syndrome by proxy is approximately 10%. Munchausen syndrome by proxy is perpetrated serially on siblings by 25 to 35%. And the etiology, it is due to the developmental disturbances, current life stresses, marital discord of the mothers or caretakers have been attributed to be etiological factors for this condition. So mothers or the caretakers themselves would have suffered from Munchausen syndrome by proxy. Next, moving on to the diagnosis for this condition. So we have to know the knowledge and awareness of the syndrome, warning signs and guidelines. There is a discrepancy between clinical findings and history. Signs and symptoms do not occur when the child is away from the mother. And the characteristics of the perpetrator, most often the biological mother, is 90%. So they are unusually calm when a major crisis is happening to the child. So characteristic of the father, minimally involved in child's life or health care. Wife generally makes all the medical decisions. And characteristics of the child victim, most common age group is newborn to 8 years. So Warnberg and Hibbert in 1995, majority of the victim die at less than 3 years of age. So if the mother having this condition, mostly they are unusually calm when a major crisis is happening to the child. So the next one is type is intentional drugging or poisoning. Here it is a life-threatening form of child abuse. And there is no classic clinical sign or presentation, and it is persistent, unexplained. Metabolic acidosis may be the only sign of poisoning. So intentional drugging or poisoning, it is less common and it can occur for many different reasons and involve variety of toxic substances and have no classic clinical presentation. So in all cases of suspected child abuse, signs and symptoms that remain unexplained by history should raise the possibility of the poisoning. So non-accidental or intentional drugging or poisoning of a child in a household tend to recur. So the next type is shaken baby syndrome or shaken impact syndrome. So this syndrome is first described by Gutkelch in 1971. So it is the syndrome that occurs primarily in the children 18 months of age or younger. So it is a form of child abuse where the infant head is shaken vigorously forward and backward and hitting the chest and shoulders. So it is most often associated with infants less than 1 year old because their neck muscles or lack of their control and their head are heavier than the rest of their body. So the classic medical symptoms are retinal hemorrhage, subdural and subarachnoid hematoma, absence of other external signs of abuse, breathing difficulty, seizure and unconsciousness. So retinal hemorrhage in infants is for all practices purposes a conclusive evidence of the shaken baby syndrome. In the absence of good explanation, that is a retinal hemorrhage is always present. In most of the cases of this syndrome, there will not be any skull fractures and no external signs of trauma. So the next one is, what are the cultural health practices suspected as child abuse? First one is dry cupping. So it is a medical practice similar to acupuncture. So there is a cup or glass in which a small amount of alcohol has been ignited, is inverted onto the unbroken skin overlaying the affected part of the body to relieve pain and congestion. So this is the dry cupping. And next to the Molira caeda. So there is a fallen fontanelle or downward displacement of the anterior fontanelle may be caused by fall or rapid removal of nursing bottle from the mouth. So in this practice, the infant is held upside down by ankles with the crown of the head submerged in boiling water. And while inverted, the infant is shaken vigorously and shaped on the sole of the feet. And what is Kaogyo? It is a rural, it is found in the rural Vietnam people, and it is literally means scratch the wind. So this procedure involved the abrasive rubbing of a coin across the oiled skin until ecchymosis appear. So the practice is routine a first aid attempt to free the body of bad wind, believed responsible for the various physical ailment. And the other practices are removal of the uvula. In Israel, there is a sanctions removal of child uvula with a hot knife during the first year of life. So the uvula is removed because it be involved, believed it absence will decrease the thirst. So the next practice is foot binding. It is practiced in China only on female children. So it results in deformation of dorsal and metatarsal structure. And the next one is cranial alteration. So it is practiced on the belief that head binding assures an individual of being reborn into the afterlife more easily and less dramatically. And the next one is skin piercing. So it is a practice of piercing and stretching the earlobes, lips, nostrils. And the next one is scarification and tattooing. So it is practiced as means of beautification or adornment. And the next one is tooth extraction or mutilation. It is a non-therapeutic extraction of the teeth and alteration of the tooth form. So it is practiced in punishment for sexual and discretions. So it is all about child